one of the things I like to do during my day is to take time off of patient care and kind of devote some attention to what exactly is going on in the research world. What are some new studies that are coming out that can potentially help complement my own research? One of the things that I found recently was a really interesting paper that was published in the International Journal of Dermatology by a group from Valencia, Spain. And what they did was they looked at treating Lentigo Maligna, which is a type of melanoma that you tend to see on the head and neck, which is a little bit elusive in the sense that sometimes it is more wide than what you can see with the naked eye. And so you have to rely really on microscopic examination for this. And so it's a very challenging melanoma to treat. This group was seeking to investigate the efficacy of their microscopically controlled surgeries. And that sounded a lot like micrographically controlled surgeries or Mohs micrographic surgery. So it brought some of my attention. And so very interestingly, what they do in Europe is they used to historically do these wide local resections, which means you just take an amount of normal skin around the melanoma and take it out and you send it to the pathologist, close the patient up, and then you either got it all out or you didn't get it all out. And if you got it all out, we found out with many, many years of research that you had a higher rate of recurrence for some reason, even though you had negative margins. And so the idea of this microscopically controlled surgery is that you're able to do the same thing, but you send it to the pathologist who does some special staining. It takes a few days. And then if they find a little bit more tumor or weird cells, you come back to the patient and you take a little bit more. Very similar to Mohs micrographic surgery, which is happening in real time. So Mohs does it in real time, while the European microscopic surgeries tend to happen over the course of days, or what we call here in America colloquially as slow-Mohs or staged excisions. And so interestingly, this group from Valencia evaluated their experience over the last 25 years with almost 194 patients, and they wanted to see what their experience was like. Did these patients have higher recurrences? Did they have bigger margins? And what led to these types of outcomes? And so the bottom line is that after looking at 194 patients at this time, they were able to distinguish between Lentigo Maligna and Lentigo Maligna melanomas, which are basically almost the same thing, except one is more invasive. And so they found out that when you use dermoscopy, which is a tiny tool to delineate your margins or to kind of pre-plan the surgical removal, using microscopic surgery, they were able to achieve recurrences of less than 4% in overall. And so what that means is after the mean follow-up of almost 3 years, only about 7 patients had local recurrences, which is incredible. So 7 out of 194 patients had a local recurrence, which is extremely low. They noticed that there was a slightly higher recurrence rate in the Lentigo Maligna melanoma group, which is basically an invasive melanoma, which you would expect. And generally, 76% of their patients had their tumor completely removed in one attempt, which is really incredible. And so the bottom line is that even though their study is a little, I would say, limited because they're looking at retrospective data, they don't have really long-term follow-up. The average follow-up was about 3 years. It's pretty convincing that staged removals are a lot better than traditional wide excisions, which are still being performed today, every single day. And so I thought it was very interesting that they're starting to open up to the idea of microscopically special staining approaches that we do all the time here. And so it's a very, very good thing for patients with melanomas, and of course, especially the melanomas that you get on the head and neck. I hope you enjoyed that. This represents an addition to the melanoma literature, and of course, it's very valuable for patients who have the risk of melanomas. So anyways, see ya.